You ever been fast asleep when sudden sharp pain in your calf or foot jolts you awake? The muscle tightens so intensely that moving your legs feels almost impossible. After a few seconds or sometimes several minutes, the cramp eases, but soreness can linger into next day. It sounds, if it sounds familiar, you are not alone. Nighttime leg cramp are common, especially when we get older. While they are often harmless, frequent or several cramp can disrupt sleep and affect your quality of the life. In some cases, they may also be associated with underlying medical conditions or medication that deserves attention. In today's video, we'll explore 10 common reasons why your legs may cramp at night, what you can what you can do to reduce them, and what is important to seek medical advice. Stay until the end because we also cover simple bedtime routines that may help reduce night cramp for some people. What are nighttime leg cramps? Nighttime leg cramp is sudden, involuntary tightening of muscle, most often in the calf, but sometimes in the foot or thigh. Unless restless leg syndrome, which creates urge to move the legs, cramp involves painful muscle contraction. Most cramps last from few seconds to several minutes, and the muscle may remain sore afterwards. Although the exact cause isn't always clear, several factors are commonly associated with these cramps. Cause 10. Muscle fatigue. One of the most common reasons for leg cramp is the muscle fatigue. Standing on the long for long period, exercising more intensely than usual, or spending day walking long distances can leave muscles tired. As the muscles fatigue, they may also even more prone to cramping later in the evening. What may help? Increase activity gradually, warm up before exercise, cool down and stretch afterward, allow time for the recovery. Cause 9. Dehydration. Even mild dehydration can affect normal muscle function. If you have been sweating heavily, spending time in the hot weather, or simply not drinking enough fluid, hydration may continue to muscle cramp. Tips: drink water regularly throughout the day. Increase fluids during hot weather or exercises, unless you have been advised to limit fluid for medical reasons. Don't wait until you are thirsty to start hydrating. Cause 8. Sitting too long. Modern lifestyle often involves hours of sitting. Prolonged sitting may contribute to tightness and reduce flexibility, which can increase likelihood of cramp for some people. If you work at desk, stand up every hour. Walk for a few minutes. Stretch your calves and hamstring during the day. Cause 7. Low level of certain nutrients. Healthy muscles depends on the balance of nutrients. Some people with a muscle cramp may have low level of nutrients such as magnesium, potassium, calcium. However, these are not the cause of every cramp, and taking supplements without medical advice isn't always appropriate. Instead, focus on balanced diet that includes leafy green vegetables, beans, dairy or fortified alternatives, nuts, bananas, potato, potatoes, yogurt. If cramps are frequent or persistent, your healthcare provider may recommend blood tests to look for the underlying issues. Or 6. Certain medication. Some medications have been associated with the muscle cramp in certain people. Example include some diuretics, certain cholesterol lowering medications, some medication used for asthma or blood pressure. If you think medication may be contributing to cramp, discuss it with a healthcare professional who prescribe it. Cause 5. Pregnancy. Nighttime leg cramp are common during pregnancy, especially in the second and third trimesters. Possibly contributing factors include changes in circulation, muscle fatigue, and increased demand on body. If you are pregnant and experiencing frequent or severe cramps, mention them at your prenatal appointments. Cause 4. Poor circulation or nerve problems. Sometimes cramp may be associated with circulation or nerve conditions. Warning signs that deserve medical evaluation include pain while walking that improve with the rest, persistent numbness or weakness, skin color changes, cold feet, non-healing wounds. These symptoms may indicate conditions that require prompt medical assessment. Cause 3. Not stretching before bed. Tight calf muscles are common contributor to the nighttime cramps. A simple bedtime routine may help some people. Calf stretch against wall, hamstring stretch, gentle ankle circles, foot flexes. Hold each stretch for about 20-30 seconds without bouncing. Stretching shouldn't be painful. Cause 2. Age-related changes. As we age, muscle mass naturally decreases. Flexibility often declines and tendon becomes less elastic. These normal age-related changes may partly explain why leg cramp become more common after 50. The good news is that regular physical activity, strength training, balance exercises, and flexible work can help maintain muscle health. Cause 1. Sometimes there is no clear cause. One of the most frustrating things about nighttime leg cramp is that they often occur without an obvious explanation. Researchers still don't fully understand why people experience them more frequently than others. Important thing is to look for the patterns. Ask yourself, did I exercise more than usual? Did I drink sorry, did I drink enough water? Have I been sitting for a long period? Did I skip overstretching? Have you have my medication changed recently? Keeping a simple symptom diary can help you and your healthcare provider identify possible triggers. What to do during leg cramp? If cramp wake you up, strengthen your leg gently. Pull your toes towards your shin. Massage the affected muscles. Walk around if you can. Apply gentle hits such as warm towel or heating pad if it feels soothing. Avoid carefully Avoid forcefully stretching or bouncing the muscle, as this may worsen discomfort. When should you see the doctor? Most nighttime leg cramps are not dangerous. However, it is a good idea to seek medical advice if cramp occurs very frequently. They are severe enough to regularly interrupt sleep. Notice muscle weakness, swelling, redness, or persistent numbness. The cramp started after beginning a new medication. They are associated with the other concerning symptoms such as unexplained weight loss or significant changes in mobility. Your healthcare provider may evaluate for underlying conditions such as diabetes, thyroid disorders, circulation problems, or nerve disorders. Nighttime routine to help reduce cramps. Here is a simple evening routine you can try. Drink water during the day. Eat a balanced dinner with vegetables and source of protein. Avoid sitting for hours before bed. Take a 10 to 15 minutes walk after dinner if appropriate. Perform gentle calf and hamstring stretches. Wear comfortable footwear during the day. Maintain regular physical activity throughout the week. Remember, these habits may reduce likelihood of cramp for some people, but they are not guaranteed to prevent them. Final takeaway: nighttime leg cramp can be painful and frustrating, but they are often manageable with a simple lifestyle adjustment. The key points to remember are: stay hydrated, keep your muscles active, stretch regularly, eat a balanced diet, uh, review medication with your healthcare provider if needed, seek medical evaluation if the cramps are frequent, severe, or accompanied by other symptoms. Your body often provides early signal when something needs attention. Listening to those signals and responding to the healthy habits and appropriate medical care can make meaningful difference. If you found this video helpful, please like, subscribe and turn on notification for evidence-based videos on healthy aging, nutrition and wellness. Question of the day. Have you ever been woken up by the leg cramp? What has helped you most? Stretching, hydration or something else? Share your experience in the comments. Your story may help someone else. Thank you for watching. I will see you in the next video.